When I first came here, I was a wreck, really. I'd been in a relationship that was extremely bad, and I had begun to fall apart because I'd been keeping things in for so long. I couldn't handle it anymore. When I was first introduced to Tyneside Women's Health, it was just instant understanding.
In the North East, we suffer from quite high unemployment levels. We are one of the highest areas in the country for prescribing of antidepressant drugs.
What Tyneside Women's Health does is it offers women that opportunity to turn somewhere for support when they maybe need it, when they can't get it from their family or their friends.
Tyneside Women's Health is committed to supporting all women, and last year we worked with over 550 women who came to access support in our centres, and about a quarter of those women disclosed to us at initial assessment that they'd been a victim of domestic abuse. 67% of those women disclosed to us that they'd been affected by depression, and 31% said they were actively suicidal. And also women coming to us who just feel isolated, and that's about 45% of our service user base.
Domestic abuse is a significant problem for the North East, and within both Gateshead and Newcastle it is something that is far too prevalent. And as a result, we know that there are often women who are living in circumstances that will affect their mental health in very significant ways.
Because some of the issues that our women come here with are very, very deep-rooted, perhaps even based in childhood, working through those issues can take quite a period of time. Tyneside Women's Health offer a series of courses, one-to-one counselling, creative crafts and activities, can offer combat to loneliness.
We set up a women's wellbeing cafe in our biker centre about 8 months ago with the aim of helping women to develop skills. Then we run a range of support groups for women as well to help women learn how to manage their mental health conditions and develop a peer support network.
When I was first come here, oh, I was terrible. I wouldn't speak, and then went on my courses, and I've been here for 4.5 years, and I've done it.
So Linked Women is a group that we set up about 4 years ago, and it's attended by service users, by staff and by our trustees. Women get to tell us what they think of our services and share ideas that they have. We created our own Undoing the Damage of Domestic Abuse programme, and that is mainly focused around the impact of abuse on mental health and how we can help women to recover from domestic abuse.
Fulfilling Lives is an ambitious and exciting programme that we have across Newcastle and Gateshead. Tyneside Women's Health have 2 workers who are dedicated to supporting the programme, and as a result they're making a very important contribution.
We support service users that have multiple complex needs, people that have fallen through the cracks of different services that really need the support but are not getting it. We try and navigate those services.
There could be drug treatment, it could be probation service, it could be mental health services, and they will help the women to physically get them to those services. When they highlight a blockage or something that prevents women from accessing those services, we will address that through the programme. They would be flagged up to the system brokers, and it would be their role to then address those problems with the relevant managers within the wider partnership. Last year we worked with the Women's Resource Centre, and we provided various statistics to them which highlighted that for every £1 invested in Tyneside Women's Health Services we could save the NHS £16.69.
By coming to Tyneside Women's Health and doing the courses I've done and speaking to the people that I've spoken to, it's got me to a point of clarity and understanding. I wouldn't be where I am now without this place.